everyone, my name is Brandy Johnson, and today I'm going to talk to you about diabetes. With my knowledge as a nurse and the research I have gotten on Hinds Community College Online Library Research Center, I can elaborate a little bit more on diabetes. I'm able to tell you what it is, the difference between type 1 and type 2, and ways to decrease your risk. So, diabetes is an endocrine disorder to where your pancreas does not produce enough insulin throughout your body. It doesn't distribute it evenly. So, when you have diabetes and you have a hypo or hyperglycemic episode, and hypoglycemic episode is when your blood sugar levels in your bloodstream drop below normal. The person becomes cold and clammy, and they can even become unconscious if the blood sugar levels aren't raised back to a normal level. So to treat a hypoglycemic episode, you're going to give them, if they're awake, orange juice and sugar. But if they're unconscious, you're going to give them a glucagon injection, which is just a little injection into the muscle that is pure sugar that brings you back up to where you are able to talk to get the orange juice or sugar. A hyperglycemic episode is when the blood sugar levels in your blood rise too high. So this patient will become excessively thirsty, they will become flushed, and without treatment, they will fall into a diabetic coma. So you're going to give them some insulin to bring their blood sugar levels back down. So now you know the difference between the types of episodes. You know the difference between the episodes. Now you need to know the difference between type 1 and type 2. Type 1 diabetes is diagnosed in children. It is also known as juvenile onset diabetes, and it is an autoimmune disorder. There is currently no cure for type 1 diabetes. Type 2 diabetes is developed over time. It is mostly found in people who are overweight or have a family history of diabetes. And there's currently no cure for type 2 diabetes either. So now you need to know ways to decrease your risk of getting diabetes if you do not already have diabetes. And of course, that would be a balanced diet of fruits and vegetables. You want to limit trans fats and saturated fats. You want to exercise 15 minutes a day, 3 times a week to keep your vital organs healthy and your body at a healthy weight. You also want to stop using any tobacco products, as this can make your pancreas wear over time. So, if you are showing any signs and symptoms of diabetes, you need to go and see your doctor. He can order a simple test called a hemoglobin A1C. This can let the doctor know how long you've had diabetes and how bad it is. It can be as simple as treatment as a diet and weight loss plan to get you under the lower levels of the hemoglobin A1C. But if you are at the risk to where you have full-blown diabetes, then he's going to order finger sticks before meals, after meals, and at bedtime. So, now that you know the difference and ways to decrease your ways of getting diabetes, you know the difference between type 1, type 2, and what diabetes is, now you can contact your healthcare provider if you have any other questions. Always contact your healthcare provider if you are exhibiting any signs or symptoms. That way you can get the proper treatment. Thank you.